I'm joined by Republican Congressman Tom Price of Georgia. He is the ranking member of the House Subcommittee on Health, Employment, Labor, and Pensions, as well as a physician. Also joining me, Rob Wilson, president of Employco Group, an employer management firm. Good morning, gentlemen. Good to see you guys.
Good morning, Alexis. Great to be with you.
Good morning.
Congressman Price, let me start with you. I look at these Kaiser Foundation figures, as I just talked about. Since 1999, health insurance premiums up 131%, 4 times the rate of inflation. What do we need to do to prevent history from repeating itself?
Well, certainly the kind of proposals that we've seen put on the table will increase the costs continually and also decrease the number of jobs and the onerous aspect on employers, which is why you see the report that you have from Kaiser there. The fact of the matter is that we've got, in these bills, we've got to address the cost drivers of health care, and nowhere are we doing that. Whether it's taxation or whether it's the litigation challenges, we've talked about liability a lot this week, lawsuit abuse reform, or the regulatory scheme that we have in health care. All of those things drive up the cost of medicine, in addition to a non-competitive market. We need a competitive market in order to bring down the cost, and there are wonderful positive ways to do that, but frankly we don't see that out of the administration or certainly out of Senator Baucus's plan.
So Congressman Price, despite the fact that in Senator Max Baucus's plan there's talk of insurance exchanges and mandates for every American to have insurance, those two pieces of the plan, I guess, are not doing enough to drive down costs.
No, absolutely not. In fact, a mandate will only increase the cost because it will drive competition out of the market. When government mandates something, then what it does is define what it's mandating. In this instance, what's the benefits package in a health insurance policy? And consequently, it will make the playing field unlevel. It will drive private industry, private folks out of the market, and it will drive people to the government plan. That's the whole the challenge that we've had talking about this government option or mandates. All of them result in a government takeover of our health care system.
Rob, I want to read a statistic for you.
Right.
A major business lobbying group called the Business Roundtable is reporting that employer health costs are going to jump 166%. Without any reform, that number would go to $28,530 per employee per year by 2019. As the CEO of a company, you're responsible for outsourcing and addressing healthcare costs, insurance costs for corporations. That's unsustainable, isn't it?
It does. There's no way businesses can afford to pay that much. When you look at the increases over the past 10 years, it's extremely expensive right now. But I don't think the federal reform is the right answer. But that percentage is who could afford to pay for it.
So what do we do? I mean, if I could conceivably be paying $28,000 a year 10 years from now, I think the average family right now pays about $13,000. What do we do? How do we address that problem? That's more than inflation.
Right, and you've seen businesses.
Go ahead, Rob.
You've seen businesses over the last 3 years surprisingly go from 40% of companies with 200 or less employees raise their deductible to $1,000. It's an increase over only 16% of companies 3 years ago. So you're seeing changes in plans from co-pays and deductibles to try and help bring that cost down. But when you look at the expenses that there's no health care reform in the sense of tort reform and expenses that the insurance companies do pay.
And I should correct myself, by the way. I think I said, Rob, $13,000 per family. I think it's like $3,500 per family. Congressman Price, go ahead, jump in.
Right.
Well, all of these numbers presume that we're in this static environment, that nothing changes except that the government gets involved in the system. The fact of the matter is we can truly fundamentally reform the system that incentivizes competition and makes it so that individuals, patients, are the ones who are able to select their health insurance. It's not necessarily the government's in charge or that the insurance company's in charge. In fact, there's another way, there's a better way, a way that works in every other service industry in our nation right now, and that is to put the consumer in charge, the patient in charge. If you do that and you fundamentally reform the real cost drivers of health care, taxation, litigation, regulation, and the kinds of lack of competition, then what you do is decrease the cost of health care for all, and you increase innovation, increase responsiveness, competitiveness, make it so that everybody's happier with our whole system right now. And that doesn't require putting the government in charge.
So taxation, litigation, regulation, your words, not mine. On taxation, proposals to give small businesses some tax breaks, but also at the same time excise taxes that could cost another 35% in terms of insurance plans. You look at regulation, litigation. I don't see much on tort. And on regulation, I don't see us doing much in the federal oversight to allow us to sell insurance across state lines.
No, absolutely. And that's why the fundamental flaw in all of the bills that have been introduced on the other side, on the Democrat side, is that they don't address the fundamental cost drivers of health care. Unless we make the right diagnosis as a physician, we can't come up with the right treatment for the disease. So we've got to make the right diagnosis. We've got to identify those cost drivers in health care, and we've got to solve those. If we do that, our system amazingly works because it's worked for hundreds of years, and if we let it work, it will, without the imposition of federal government rules.
Rob, what are we doing right and what are we doing wrong in this health care reform debate as it pertains to business owners?
Well, what we're doing wrong for business owners right now is they're struggling as it is in this economy. So you're talking about taxes on high-end employer health care, which we really don't know what that tax and what is a high-end health care plan. They're talking about taxing business owners that a lot of times the credit market's so tight they're using retained earnings to cash flow their business. So you need to look at small businesses account for 80% of new jobs in America, and it's a job killer. When you look at the amount of new taxes that small businesses are going to have to swallow with this, they won't be able to afford to hire. So we need to look at we do need to control costs. This year the premiums only went up 5%, according to Kaiser, which is the lowest increase in probably 10 years. So we need some more competition, but
here's the issue,
now,
Rob. But the issue, Rob, and I want to show people this so they understand this. While the premiums may have only gone up 5% this past year, businesses are forcing their employees to offset some of these rising costs by paying higher deductibles. How do we reform that? I mean, at the end of the day, it goes back to the employee.
Right, exactly. I was at a business a couple days ago that average person was making between $30,000 and $40,000 with a $1,000 deductible, and with a rate increase, their employees can't afford it. Surprisingly, a number of businesses don't use the flexible spending or cafeteria plans. And a point in this proposed bill is that they want to limit the amount of flexible spending that you can use, which enables you to use pre-tax dollars, which helps reduce the tax load on the individual employees.
You know, Congressman Price, I'm married to a small business owner. My father's an entrepreneur, and I see what they're going through. I see when they bid out insurance, it's outrageous. And in this environment, they are cutting benefits. So how can we find some uniform agreement together to create change to cut those costs?
Well, in that instance, what we need to do is to allow small businesses to pool together and make it so that they can get the purchasing power of millions. Instead of being in the small group market, they get an opportunity to pool with others across this land so that they drive down the costs of their insurance. We ought to be able to purchase insurance across state lines. Individuals ought to be able to purchase insurance with pre-tax dollars, the same benefit that businesses have right now. There are wonderful, positive solutions out there that embrace fundamental American principles of free market capitalism that will solve the challenges that we have and won't put the government in charge. That's where we ought to be right now, instead of the discussion that's moving in the direction of more government control, more taxes on businesses, more job-killing activity from here in Washington, which is absolutely the wrong direction in which to head.
All right. Well, we're going to leave it there, gentlemen. It's to be continued. Thank you very much.